All right, so thank you guys for coming. So through February, we've kind of done a lot of feline friendly. So I've done this same little thing for like department meetings, and then we are having 4 sessions this week. We are trying to increase our safety is one of our big goals with talking about being feline friendly, but also just in general, making the cats feel more comfortable with how we're interacting with them. So we're going to start with a little video. It's done with a GoPro. There's not really a cat in the kennel, but it's a really good thing to watch because it shows you what a cat has gone through even before they get into the exam room with you and the doctor and some of the stressors they might experience. It's your mouse hooked up. Far right corner. Far right corner. Is that working? There you go. There. Here you go, kitty.
Oh, it's just you're in there. Oh, you're so pretty. I like your whiskers. Oh my gosh, look, sweetie. Hey, Kitty. Kitty. Oh, that's so sweet. Hi, Kitty. Come on out.
Come. Will that bring up my PowerPoint? Right, there we go. All right, so like I said, a little bit over dramatic, but not really outside of the realm of what happens. I see a lot of employees even hit the cat kennels on the doors coming through. So even then the clients will do it as well. And then it's with the dogs, especially in the lobby. Other people are like, oh, my dog loves cats. But you don't know what that cat is feeling. So it does point out a lot of things that we see on an everyday basis in a vet clinic. And that's before the cat even gets to us. All that's happened. So they're already pretty amped up. So what we see usually is frozen fear. That's the top cat. And that's 90% of the time what you will see when you go to remove a cat from a carrier or a kennel is that you're seeing frozen fear. Down on the bottom, that's an aggressive cat. We usually have to push the fearful cat to become a cat with aggressive tendencies. I see a lot of cats marked as aggressive in Easy Vet, and I don't think that's right. They should be marked as fearful or anxious. So when you're putting those tags on the pet, really be mindful about why you're choosing aggressive. Did that cat come in swinging right away, or did it have interactions that caused it to have aggressive behaviors? Because if that's the case, that's not an aggressive cat. It's a fearful cat that we didn't handle in the best way that we pushed to have aggressive behaviors. So I would like to see the cats being marked as aggressive to decrease overall as a hospital and use that anxious. I think there's an anxious one that you can choose for their general temperament. That's more appropriate. So with frozen fear, it's exactly what it sounds like. They're not going to move. They kind of curl up in that kind of poised position. They won't eat. They won't drink while they're here a lot of times. And then when they get more aggressive, this is when you get the cat that starts to hiss and spit and vocalize at you, and then they will bite and scratch. A cat most of the time is going to try to scratch you first before it tries to bite you. The exception to this is cats that are declawed. They know they're declawed, and so they will always try to bite you first because they know they don't have claws, so they usually won't waste their time with it. Very few cats are going to start with those mannerisms. We're going to have to work our way up to that. Some body language that you can watch for. Down here in the corner, the far right corner, that's like the worst case scenario ever. We call it a Halloween cat, but you have the most aggressive and most fearful form of the cat. I've never seen a Halloween cat in a veterinary setting. The times that I see them are out, like when I see cats in feral colonies and like an outside cat comes into the feral colony. This is truly the only times I've seen that true Halloween cat posture. You would have to do a lot to get the cat to that point. What we usually see is over here, this guy. That's the one that we see in the kennels. That's what we see in their carriers when they come in or when we go into the exam room. And then as we work with them, cause some frustrations, then we creep our way up and we can get to this. And that's usually when they'll start scratching and biting us, and then we have to back off. This guy's just like, meh, I'm not really sure. This is the cat that's usually walking around the exam room, but will have its tail tucked. The tail is also a really great thing for you guys to watch. It's large too, so it's not very subtle. It's something you can easily identify. If they're friendly and content, it's usually upright and happy. If they hook it on the tail, it means I'm still friendly, but I'm just unsure. I might be in a new environment. So those would be good things to see. As the cat becomes more nervous or submissive, you'll start to watch that tail drop. So just like dogs do, they will drop their tail, and that means that they're submissive. If it's tucked all the way under. If it's just down, that could be a potentially aggressive behavior. We also see this guy here. It's a poofy tail. And if you guys have ever had a cat that gets really upset, they will get a big giant poofy tail. And then we also will see tail twitching and tail thrashing. So if it's just the tip of their tail twitching, you still want to be cautious. That cat's alert, but they might just be interested in what's going on. If they're doing like a slap, slap, slap of the table, that cat is really angry. And then the faster and the harder that they're slapping their tail, the more angry and upset that they're giving. And you need to start backing off with whatever you're doing because you're upsetting the cat. So those are great. I like watching the tail a lot. They're easy. The other thing is her ears, you guys. The ears are usually upright and happy. And then as the cat becomes more fearful or more aggressive, they start to turn, 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 turn until they're plastered against their head, like we saw in that first picture of the aggressive cat where they're pinned completely back. So why do we care? First of all, for patient care, it suppresses their normal behavior. So cats won't rest. Those of you that work overnight, you've probably seen those cats that literally just sit in the kennels and stare all night and they don't sleep at all. That's not helpful for healing. Just like when we're sick, if you don't rest, you don't get better. It takes a long time. Also, feeding. Cats will win that game. They aren't like dogs where we can usually wait them out and they'll finally get hungry enough that they'll eat before they leave the clinic. A lot of times we do send cats home with the owners to see if they'll eat at home for the owners, because we create such a stressful environment for them here that they have no desire to do their normal behaviors, which feeding's kind of a big one. So that is why you guys will see patients going home or feline patients go home without eating. It's pretty acceptable. We used to not do that when I first started, and we would go, like, we'd give them Valium as appetite stimulants and things like that and be like, you have to eat before you go. Thankfully, we switched our minds on that and understand cats that are in an unfamiliar setting oftentimes won't eat. The increased vigilance, that's just the looking around, very stressed, always on high alert. Oh my gosh, are you going to come to my kennel and do mean things to me again? Someone just walked by me. There's a dog. What's going on? Anorexia, vomiting and diarrhea. They can get GI signs from being stressed out. That's similar to people too. That's some people's response to stress. And then they can have lack of elimination. So they won't urinate or defecate while they're in the hospital. I had a little Bengal cat that I had, Dr. Carney wanted to compare her specific gravity from a cysto to her specific gravity on a free catch. And I had that cat here for over a day and I could not get the cat to pee in anywhere. I took all the bedding out. I was like, maybe she's peeing on the bedding. I finally figured out what she was doing. She was sitting on her rump and then she was licking her vulva just enough to express a little bit of urine. And then her bladder was still huge, but she did that just enough that she could tolerate it. So I called the owner. I was like, there's no way. I was like, she's been here a day and she won't use the litter box. I'm like, I finally saw what she's doing to keep herself where she's not exploding. And I sent him home with the stuff. And he said she literally leapt out of the carrier and instantly went into the litter box and peed. And he collected the sample in the cup for me. But cats are just different. A lot of times we won't win out over their stubbornness. If they're uncomfortable, they're not going to do something. A couple things that we see as far as a physiologic response and changes in laboratory. The biggest one is hyperglycemia. So that's an increase in your glucose level. A lot of times in IM, we get transferred cats for diabetes. And it's actually not diabetes. It's a stressed out cat that had a blood draw on it. They did a study and cats they had some cats that would get close to 600 on their glucose levels just from stress. So when these cats come in with those BGs between like 150 and 200, we really need to pause and think about that cat's experience and make sure we're sharing that with the doctor. Hey, I got your blood. Cat was not happy with the whole situation for sure. Then when my doctor gets blood results back, that's in their mind. And so they're going to take that into account when they're doing interpretations. But yeah, we get a lot of kitties that are probably not diabetic and they're just stressed out kitties. Can decrease your serum potassium. Hypertension is another big one. A lot of people are just like, yeah, 160 to 180, that's normal blood pressure for a cat. It's normal blood pressure for a stressed out cat. Okay. So we've adopted it in veterinary medicine. And even when I went to school, they would say that. They're like, oh, heart rate of 200, normal. Blood pressure of 180 in a cat, normal. Not really. It should be just like a dog. It should be closer to the 120 mark. It's just that we understand that most cats go through some kind of stress. And so we take that into account. When I do my exams in the room with Dr. Carney, heart rate was 120 to 140. That was my typical cat heart rate. And my blood pressure was usually around the 120 range. And then if I was getting blood pressures of 180 to 200, then we started looking at starting that cat on hypertension meds. So we've got to change our thinking a little bit on that, but I know we see that as acceptable. They can get elevated serum creatinine. They also get stress leukogram. Some of you have probably heard your doctor say that when they're rounding. They'll be like, oh, so-and-so has a stress leukogram. It means they have an increase in their white blood cells that's caused from stress. It's not because of it, like an infection or anything like that. They get erratic responses to sedation and anesthesia, which makes our lives a whole lot more difficult because a lot of these times we want to give sedation so we can do procedures like ultrasounds or blood draws on the pet. The more heightened the cat is, the harder it's going to be to do a good job with those sedatives and then your anesthesia. And so if you can keep the cat de-escalated while you're sedating it, you're going to have better success rates. Immunosuppression, just like us, you guys know when you're really stressed out in life, your immune system takes a major hit and you feel like you're just getting sick all the time, back to back to back. And then we can see heart murmurs too. So I love this because what stresses the cat out in the hospital, it's basically everything that's in a veterinary hospital is what stresses the cat out. It's our day-to-day activities is what the cat finds stressful. So they find other animals stressful. They find humans stressful. They find noise stressful. They don't like different smells and odors outside of their house. They don't like being in a cage that they can't hide in and go where they want. They don't like unfamiliar people taking care of them. They don't like unfamiliar food or feeding routines, and they don't like sensory overload. So we pretty much just described a veterinary hospital in one slide as the things that the cat despises. And that is what we're taking them into. So where we come in as the caretakers is we have to do everything we can to alleviate some of these stressors. We can't eliminate them just because it's a hospital setting, but we can sure do a better job of helping the cat feel better while it's here. First thing we can do is recognize that the cat is fearful or anxious and immediately start working to decrease that fear and anxiety for them. So we talked about the change in the ear position. I'm going to come.
I don't know. Kitties and their sisters.
Yes, yeah. So we'll see if they come out. But changes in ear position, that's another really easy one. Like the tail is a large body part that most people can look at easily. Eye changes are more subtle, other than getting big, giant, dilated pupils. That's a pretty easy one for us. But watch those ears if they're coming. I mean, this is good because you see our tail kind of tucked and we're doing the slinky. I'm kind of crouched down on the floor. I'm not overly nervous, but I'm like not totally feeling this new room, and you are going to crawl under that like they all do. The other thing that cats will do is they'll sweat from their paws. So if you ever look down on the table and you see little kitty footprints everywhere, that's a response to stress, and they're sweating. Escape attempts. If you can work with a cat in an area that you can close off, like in here, internal medicine, exam rooms, radiology, we have really great areas in the hospital. We just don't utilize them like we should. You want to do that because if a cat were to get escalated, they just want to run and hide. And so then you can just let them go. The cat's going to jump down in the corner and go hide. That's what they want to do. They don't want to fight you usually. So I always tell people if you're losing control, if you're in an enclosed space, just let go of the cat. And then you can go throw a blanket over the cat and get control of the situation in a minute. But they're not gonna try to bite you first usually. Vocalization, aggressive behavior, that's the biting and the scratching, freezing, and then frantic grooming. You've all seen frantic grooming after you've witnessed or helped with a blood draw, and then you go put them back in their cage, and then they're like, oh my gosh, it's like a little OCD relief moment for them. So if you see that over grooming, it's a stress reliever for them. Oh, you're so adventurous. I love it. So good. So what to do when you start seeing that fearful cat? Avoid excessive restraint. That is something I feel sometimes works for canines. We always start with less is more for canine or feline. That's our golden rule, always. But sometimes with dogs, like if you lean into your hold a little bit more, then they actually relax and they stop fighting you so much. The opposite is going to be true for your cat. The more you lean into it, the more pressure you apply in whatever restraint you're doing, the more amped up your cat is going to get. So it's really hard because that first instinct when we start to get nervous with the animal we're handling is to put a little bit more force into it. So you want to do the opposite of that. We can implement feline-friendly nursing care, pain control, and then, of course, sedation. Drugs are our friends for our feline patients, and don't be afraid to advocate for it. I know sometimes owners are concerned about the cost or not having their patient sedated. It just needs to be a little bit of an education while it's actually better for their animal. No owner wants their animal to be stressed out or have a really poor blood draw happen. So if you just explain to them why the sedation is needed, they're usually okay with the cost of it. It's just, we usually just are like, the cat needs to be sedated. We need $150. And then that usually doesn't go well. The golden rule, and this is for dogs and cats, always use the least amount of restraint as possible. You want to remain calm and patient. Cats are very much like horses. So they're very intuitive to your energy that you're putting out, and they will feed off of that. So if you have a nervous, anxious energy going into working with them, they're going to pick up on that and they're going to take advantage of it, just like horses. Horses harass the people that they know are afraid of them because they know they can get away with it. So cats do the same thing. Be flexible. Where are you doing your procedure? Where are you doing your exam? Does a cat want to be in its kennel for its exam? Take off the top. We don't have to do the exam in the same place every single time. If there's like right now, I could go over and do his vitals on the floor. There's no reason I can't do that. I don't have to put him up on the table where he doesn't choose to be. And I did that constantly when I had to do all my exams in the room with the owner. It was wherever the cat was, owner's lap, kennel, floor, counter, sink. Sometimes I'd curl up in the sink. Be flexible. We don't have to be so rigid with our thoughts. And then give the cats a break. We don't have to get blood, urine, and x-rays in one go. No one says that. It's just in our mind, we're like, oh my gosh, we have to get this done as fast as possible. Not giving the cat breaks if it needs that actually is going to end up spending more time in the end, because you're going to end up with a fearful or aggressive cat by the end of your adventure and end up spending 2 or 3 hours then trying to get sedation into it. Versus if you drew blood, saw the cat was now flicking its tail around, give it a 5-minute break. Then I go get urine. Cat starting to get squirmy and kind of rolling around. I put it back for another 5 minutes. Then I go get x-rays. Adding 15 minutes of time to breaking those things up in the end will save time versus now I have an out of control cat that I have to sedate to get x-rays on. Because now I have to get drug orders. I have to somehow get the drugs into the cat that's angry. Then I have to wait for the drugs to work. And now I have to wait for the cat to recover before it can go home. So something that could have taken me 30 to 60 minutes has now taken me 2 to 3 hours of the cat being here. So don't see breaks as a loss of time. They save you time. Kitty minutes. If you've ever worked with me, you guys will hear me use the term kitty minutes. Every cat has a set of kitty minutes. A more tolerant cat will have a longer period of time, and then more fearful cats have a shorter period of time where they're going to allow you to work with them. So just use your time wisely and read the pet and decide, do you have few or a lot of kitty minutes? So in the exam room, same thing. More is not better. Try to be as hands off as possible. Interact with the cat as least as you have to, because the doctor still has to come in too. If the cat you can tell is going to be more fearful or have a few kitty minutes, get the doctor and then you guys do your vitals and exams together. This is something though that went away with COVID. I don't think we do vitals ever in the room anymore. I would love to see it come back. I think it's strange. It was odd to me that it didn't come back with it. But yes, we used to do all of our vitals in the exam room with the client. From a standpoint for the pets, it's way better. Their stress level is lower when they get to stay in the exam room with their owners. And then I don't know, COVID changed that and we still just bring them straight back. Be mindful about allowing the owners to restrain. You guys can get a pretty good feel for what owners are going to be a helper and which ones are going to be detrimental to you getting what you need on the animal. Cat owners love their cats. They're very in tune with them. They're very emotionally connected to them. So trying to cut them out does not work. And you're just going to cause more stress for the owner, which is going to stress out the cat. So what I do is I will give very guided, directed, helpful tips for the owner on how I want them to participate. So if I can tell this owner is not a good candidate to hold for me, okay, they have a lot of anxious energy, I can just tell. I will be like, why don't you come over here and talk to Fluffy? That would be super helpful for me. Can you come over here and lightly pet Fluffy's head for me? That is so helpful. Okay, so I'm inviting them to be a part of the exam. So they're still with their pet and I'm telling them how helpful it is. That is how you approach the cat owners and get them to help you without hindering what you need to do. And then there's other cat owners I can tell are great, and I'll have them hold the cat, and I'll invite them to hold the cat for me. Always check and make sure that they are comfortable. There is some liability if you did really get a jerk owner that was holding and then the cat attacked him, we could be liable for that. But if the owner asks to and consents to be part of that, that would be a pretty hard sell. You know, be like, well, I did ask if you wanted to help and you said yes, or you requested to it. And like I said, once again, if it's an owner that you don't think would be good at holding, you just then direct it. Say, oh, you know, no, I think I can manage the body myself, but if you could do this, that's really helpful. Right, so use those words and then you'll get a lot better success. You want to leave them in their carrier for as long as possible. So when I go in to start my exam, I open the carrier and I just tell the owner, I'm like, we're just opening the carrier. We're going to chat. I'm going to get history. Your pet's going to get used to my voice, my smell, and we're going to let them do their thing. They're going to get used to the room. I was like, if they choose to stay in the carrier, I'll do my exam in the carrier. If they come out, I will come to them and do the exam. So I always start with letting them just invite them out if they want. If they don't come out, we would, like our other friend that's still sitting in this carrier, I would try to do my exam and my vitals in there. Cage restraint. So if you have a cat in a kennel, really try to give it some place to hide. You're going to keep its anxiety down, and you're going to have a lot better hospital experience from the start. We have wonderful feline ward. The intermediate ward, I think, is really underutilized. I come out often in the triage area, and there's cats sitting in those kennels waiting for like an abscess repair, and they'll sit hours in that really busy area. There's no reason those patients shouldn't go into our intermediate area. That's what it was made for. IM has a bank of kennels too, and it's a little bit quieter in there, so you can poke your head in there. There's kennels all around. So once again, that's getting creative, and you don't have to leave the cat in that really noisy area for hours while it waits for its procedure. Also in our feline rooms, you can dim the lights. There's music playing. It's going to start their experience better. Give them somewhere to hide. This can be preferably if you can get their carrier in there and just leave the door open and let them use their carrier as their hiding place. That would be the preference because it smells like them too. It's familiar. And so they're going to prefer that. If not, even a blanket, a towel, that's great too. Just something. Sometimes I see people making boxes, which is also really cute. Mark the cages too. This is like the caution, go slow. Once again, I probably see like excessive use of the orange stickers sometimes on cats. My only concern with that is once again, the energy I bring to that cat that has 5 stickers on it is different than the energy I'm going to bring to the cat that has no stickers on it, or a cat that just says go slow. So just think about while you're putting that sticker on there, and maybe 5 is a little overkill. Okay, maybe we don't need all 5 of them. Pick and choose, and then let them come to you if you can, if they choose to. So before you start any kind of procedure, you want to be prepared. So your x-rays, you should have your patient pulled up, ready to go. You should have all your settings set. You should have your trough on the table. Everything should be clean. If you're doing a blood draw, you should have a couple sets of needles and syringes. You should have all of your blood tubes. You should have a Band-Aid ready. This will make things go much smoother. You're going to decrease your cat's fear because it's going to be out for a short period of time. So don't ever get your cat out until they're ready to go. And then you want to keep the cat close to you. A lot of times people hold them out on the table. So a lot of times they'll come down and people are holding cats like this on the table. It makes them nervous, and you can already see tails flicking. My ears have gone back. I'm trying to back up. Versus if I just snuggle a cat into my arms, then they're going to calm down a little bit. Oh, did I take your friend? The shyest you ever. Okay, so while I'm waiting for my person to place the IV, this is how I'll hold, and I'll just scratch their face, let them get used to me. Goodbye. It's like, I just thought I got to sit on the floor. This is not fair. Go to a quiet area in the hospital. We fail big time at this.
so bad do we fail at this. I see cats mainly done in the noisiest place in our hospital, which is our triage procedure area. We have so many places in this hospital, you guys. There's a lot of times that different departments are out. So you could use surgery outpatient, you could use ophthalmology, you could use dentistry, IM, radiology. There, you can use an exam room. There's so many places that we can go. So just try to think about that before you get the cat out. Also, there's nothing wrong with doing a sweep and say, hey, I'm getting a cat out. If we can just keep it quiet in here for a second, we're going to place this IV real quick, and then they can go back. And IM's always happy to share our procedure room as long as we're not in an active procedure. So Thursday mornings we're in procedures, and then usually in the afternoons. But in the morning time, feel free to come in there. It has dimmable lights. You can close both doors, so there's no exits and there's no place to hide in there. There's nothing the cat can climb into. Close all your exits, and that's just something good over there. So trying to get away from scruffing is another big thing. So what our go-to should be for kitty restraint are our kitty burritos and then a neck, which I will show you, or a neck wrap.
I sprayed them.
Which you already did. Oh, perfect. Okay. So this is Feline spray. If you guys haven't seen this and you work in a department where this doesn't live, you need to let me know so we can get you some order. It's a feline pheromone, very soothing, nice. You just don't ever spray it, like if my cat was here, you don't ever spray it where the cat's here. It's alcohol based. Kitties don't like alcohol, and they don't like spraying either. Okay, that's why most people try to correct it with spraying, like water bottles and things like that. So you spray it preemptively on the bedding, on the towel that you're going to use to work with them on, and then you put it on the kennel or you put it on the cat. Don't ever spray it directly on the cat. Hi. Over you. Well, you are grumpy. Good.
His blood broke through my blood earlier.
Oh, he's the one covered with that. Okay. And you guys, it can be really light like that. Okay. Yeah, I know. She's sort of mad. Hey, monkey. Should I get your sister? Should we see if sister wants to play? And she's like, yes. I would like you to see if sister would like to come instead. So that's how you can get them off the floor, you guys with the towel. Cover their face. It's the see no evil thought. If I don't see it, it's not there, it's not happening. Also, if the cat's going to bite or scratch you, if they don't have a direction to go in, you're much less likely to get bit or scratched. Oh, yeah. Like now I'm gonna headbutt you and love on you.
Sister's getting low.
Sister's getting love.
Come out for me.
Yeah. Do you want to go do the other burrito? Do you? I like your back. Here we go. Okay, so if I was getting ready to burrito and I wasn't taking the cat off the floor, just put them down, and then you're gonna wrap. You're big. Gonna wrap, and then I'm gonna wrap, and then I tuck, and now I have a needle. So I could do a temperature. My friend could come and get to the booty, and then I'm not gonna get bit or scratched. I can look in the mouth if I need to. And let's say I needed to do an IV catheter. I could come in here, sneak out a leg for my friend, and then I still have control of the other 3 legs. All right, so kitty burritos are wonderful. Oh yeah, you're in a much better position. I know.
She's a lot fatter.
Yeah. Oh, okay. It's okay.
Yeah.
The other thing is a neck towel or a neck wrap, either way you want to call it. I'll switch the slide here in a second, but just why I have
her. But you just roll up a thinner towel. Don't use a big, thick towel. It's harder to have control over them if you use a thick one. And then you just go under and you go cross, cross. And now I have control of my head. And this kitty cat can't bite me. You can apply a bit of pressure. People are like, well, you can suffocate them. You guys should have to put a really weird amount, like you would know you were doing something wrong to choke the cat with this, and you would know you were using an excessive amount of. We're always like, I feel like I'm choking them. You're not going to unless you are really trying to. And it's wonderful. So this is what we do instead of scruffing. Those should be your go-to things that we start with. Shouldn't start with scruffing. I see a lot of, hi kitty, do you want to come out of your kennel? No, okay. And then a scruff and a pull, and literally the cats are given like 1 to 2 seconds to walk out of their carriers for you. And just think of the video, just think of the car ride that they went through. Then you set them on the back table where they don't know what's going on. There's 8 million dogs. And then you're like, come out. Oh, you don't want to come out. I will pull you out. So don't start with that. Give them a chance. And then this is the neck wrap. We won't watch the video because I demonstrated it for you. Sometimes I don't have feline volunteers, so that's why there's a video one. So scruffing, usually not necessary. The reason why I put usually not necessary is because if it comes down to a safety issue, I will scruff a cat. If it means my coworker or my doctor is going to get bit, yes, I will scruff. Also, there are a very small subset of cats that do respond well to it. But honestly, you guys, after they're kittens, they don't, it's not a thing anymore for them. Once they reach that year age, scruffing isn't super effective for them because mom isn't doing it anymore. Mom hasn't been around for a long time. So just be mindful of using the scruffing and definitely don't start with it. That should be something we do in last ditch effort. And then it's usually a scruff and then I put the cat in the kennel. It's not I scruff and I continue to do whatever I'm doing. It's just to regain control of the situation and then we'll regroup and come back to it. If you're interested in resources, catvets.com is where you want to go. It's by AFP, which is the American Feline Practitioners. And they have a lot of free CE, that's race approved, for feline friendly handling. A lot of their stuff you do have to pay for, like a lot of their medical CE, or you can become a member and it's pretty cheap. It's like I pay for it. It's like $125 a year. And then I get a whole bunch of videos, but they always keep their restraint stuff free because they want to promote it. There's actually a lot of handouts on here too that you can give clients. So if a client ever says, well, my cat just hates its carrier, or my cat hates coming to the vet, you can direct them to catvets.com. And there's so many resources like, how do I get my cat to like the carrier? How do I get my cat to be okay with car rides? And they have all these brochures for that. So it's a really great resource, not only for yourselves, but it's a really great resource to give to your feline owners too, especially if you hear them make those little comments. And I know we were talking a lot about client service and how we want to go an extra mile for our clients this year. So that's an example of something really easy. Just if they make a comment about how they're struggling with something, that's going the extra mile. Be like, hey, let me give you this website and they have really great tips for you. How we talk about our kitty cats in the hospital, it is important, and we do want to kind of shift how we talk about them. So just think about the tone and the attitude that you have towards the pet. A lot of times, I will hear people be like, that's the spawn of Satan cat. They'll eat your jugular. And you're like, oh, okay, I really want to go interact with that cat. I'm going to really calm energy around that cat. That's not how it's going to work. Versus if someone came up to me and said, oh, this cat is pretty scared and can be spicy sometimes. Do you mind helping me? Okay, I'm going to bring a much different energy to that patient versus the one that someone told me is going to rip out my jugular. I'm not going to have a very soothing energy about me. This has to be a hospital shift and pay attention to how we talk about it. And also don't be afraid, you guys. I know it's hard with coworkers sometimes, but if you see something that isn't super feline friendly, just gently saying, hey, probably not the best way to do that. That seems to be upsetting the cat, something like that. If you don't feel comfortable telling someone that, that's where you can kind of get me or Brooke or Ambria or your supervisor, then we're happy to have those little conversations. But honestly, you guys,
Hearing it from your coworkers honestly is way more impactful usually than it is from a supervisor or a manager stepping in because we're not there in that moment. So following up after the time has passed just isn't as effective. And then if everyone gets on board with this, then we just know as a group we don't do those kind of things and it will cause everything to shift. So reception area. We want to encourage, and we'll talk about carriers a little bit. We'll talk about the more appropriate types of carriers to recommend for owners. And then you want to make sure that cats have an elevated area for the carrier. In the video you saw, because the cat was down on the ground and then all the dogs were coming up to the cat carrier. Thankfully, we have these really awesome benches. And then in our feline ward, we do have little cubicles that they can also, not cubicles, but cubes that they can sit up on. So cats should always stay up off the ground. And then ideally, you would have a separate waiting area. We do, thankfully. That's what that door right when you come in on the right is for. That's feline waiting. I know sometimes it's been turning into like a discharge spot or an exam room, but as much as possible, that should be left for our feline patients to wait in. You could do it if you worked in a clinic that wasn't built with this in mind. You can use like panels or even like big plants, things like that. And I have some pictures. As soon as possible, get them into the room. The feline waiting room has a feline diffuser and room 1 has a feline diffuser, and then a couple places in the hospital too. But our reception area is so big and it's been the Feliway diffuser wouldn't work well in there. And it's always Feliway Classic too. I put that note because there's a Feliway multi-cat. Feliway multi-cat is for inter-cat aggression only. It doesn't do the soothing. It's completely different. It's much cheaper though. So owners will oftentimes, when we say buy Feliway, they'll go get the multi-cat and they might only own 1 cat. It's very specific for inter-cat aggression. So we don't want that. So preferred carriers. It's that one. And I know you guys don't love it because the screws take longer to get undone. And so if you were asking us which one we would prefer, we would say the clampy one because it's faster. It's the noise. You guys know how loud those clips are when you undo them and put them back together versus the screws don't make any noise. So if an owner does ask you what the preference is for a carrier, we like to recommend these guys. I forgot to grab it this morning, but I also have soft-sided kennels that completely unzip. The zipper goes all the way around. So I can unzip the door and I just keep going and then it unfolds completely. So that's another great option. They're pricier. They're usually around $40 off of Amazon. And so I don't know, for me, I have 2 of them and that's what my cats always come in when they have to have vet visits here just because they are nervous and I don't want to have to be trying to wrestle them out of a carrier. I have every single type though. These guys are hard and you can see why, right? So those were nice cats, but if that was an aggressive cat, there's no way. I could not safely get the cat out of there. I would have had to put a giant towel on top of the cat and pick it out of the carrier there. So that's great if you know your cat and it's for like your own personal use. But when owners bring their pets in these type of backpacks, it terrifies me because we have a technician that has to go in to get them like that. That's scary. Scary for the cat too. I mean, you saw that in the video when people like put their face right in front of the kennel, what that would look like to the cat. So that's terrifying too. I'm going to come at you from above is very threatening. So examples of waiting areas like that, if they didn't have a separate room. So you can use tables, just something to keep the dogs out there. And then you'll see here, they have the little cubby holes and that's where their carriers could sit while the owners were waiting. This one just has a panel. Here's ours. All right, those are supposed to be for kitty parking, but it ends up with who knows what. I've seen some really interesting things when I go there. But yes, that's supposed to be for carriers to go in. But a lot of the owners just keep the kitties on the couch with them. Exam room, try to keep it warm, provide a non-slip surface. A towel is fine. It doesn't have to be like a little yoga mat or those grippy mats at all. And then just read the cat's personality and make adjustments. If the cat wants to interact with you, interact with the cat. The cat just wants to go sit in the corner, you just let it sit in the corner until you absolutely have to interact with it. Don't engage with it early. Have all your equipment in the room, thermometer, ideally, which I know people like lose their minds about, but you guys all sample collections for an outpatient would be done in the room. And that's how I did all my behavior consults. I did my cystos in the room. I did my blood draws in the room with the owner and the doctor. That is the least stress for the cat because I'm not moving it room to room to room to room. Makes a lot of people uncomfortable though, because you have the owner watching you, which makes people nervous. And then once again, COVID definitely just changed our relationship a little bit with, oh, the client's going to be involved with this. What? I'm not sure about that. So yes, in the perfect world, I'm just taking baby steps. If I could get him somewhere quiet first, I'll take that. And then we can work on doing stuff in the room. We'll go in steps. And then the pheromones. Go slow. Being hurried, the cat's going to sense that. So don't let the cat know that you have 20 other rooms that you got to check in. They're going to sense that, or that you're running behind. Still take your time, breathe deep, don't rush through it. Don't force the cat out of its carrier. Don't let the owner do it either, because they're trying to be helpful. That's why I always start my conversation of, please let your cat choose if they want to come out. When we get ready for vitals, we'll see where they're at. Do not pull them out of the carrier. They're just getting used to me. Slow blink. If you guys have watched My Cat from Hell, Jackson Galaxy, he's super big into the slow blink. Slow blink can work. But it's basically you make eye contact briefly, kind of like from underneath. Okay, don't like directly. It's not supposed to be aggressive. It's supposed to be like a sweet thing. So kind of look up from under your eyelids, and then you do a slow blink and look back. If the cat does it back to you, that's kind of like, oh, I trust you. They say a cat, I love you. I don't think that's necessarily true because I can get my feline patients here to do it with me, and I definitely don't think they love me, but I think they have trust with me. So I call it a kitty, I trust you, or you're soothing to me. I'm not super amped up right now. So if they do it back, great. If they don't do it back after you try once, don't do it again. Okay, that cat's not interested, and then they're going to start thinking that you're challenging them. If you consistently make eye contact with them, they're like, oh gosh, I don't like this person. Still take your breaks. All right, get a heart rate. Talk to the owner, pet the cat. Get a respiration, pet the cat. Get a mucous membrane, pet the cat. Get your temperature. I always save temperature for very last. Blood pressures I would do right after heart rate and respiration before temperature. Reward the patient if you can. This is hard in ER, and I know, or for like specialties, can be hard if they need to be fasted or need an ultrasound. Honestly, guys, one little treat is not going to ruin your surgery. Be honest. But for a cat coming in through ER, if it's coming in for vomiting or GI symptoms, not a good call. The cat that's coming in hypersalivating everywhere, not a great call to try to offer that cat a treat. So I got included on an email chain that a client was upset that we offer dog treats but not cat treats. So I gave my recommendations of what cat treats can be in the room. Just cats are so sensitive with their guts, and they look at a new kind of food and they start vomiting for 2 weeks. So I'm just like, I don't know about that. So I did recommend hydrolyzed protein diets that Royal Canin has. So if those pop up into the exam room, that's fine. But just be mindful of why the pet is there before we're offering them treats. But it's fine to reward them. My behavior cats, I got to reward a lot of times, but they weren't there for usually medical things. Okay, so the cat owner, we've talked a little bit about them already. So the cat's going to feed off the owner's emotions, and the cat owner will feed off what they perceive the cat's emotions are, and they get a little intense. Like I said, they're very emotionally connected to their cats, and they can be a little bit intense when you're working with cat owners. It's a different kind of relationship. So avoiding certain behaviors that will increase anxiety. And a lot of these things come from what I as a person think is soothing that I'm trying to put on my cat, and it's the opposite. So clutching the cat is a big one that I see with my nervous owners, and they'll have the cat like this, and they're like, it's okay. It's okay. He doesn't like it. Oh, okay. And you're like, or you don't like the vet. So if I was a nervous child, I want mommy and daddy to come snuggle me and have me close and make me feel comfortable. The cat, this is like the most terrifying thing in the world. Like I just went on this horrible car ride, you hit me into the door, and now you're in here like strangling me. I don't like that. The other thing is the staring into the face. That's another thing that us as people making eye contact and being like, it's going to be okay. That's soothing to us. For the cat, that's terrifying. They're already heightened, they're already worked up, and now you're challenging me. I don't understand what's going on. The shh, it sounds like hissing to a cat, and it's threatening.
So we shouldn't ever shush. That's it. Once again, it comes from a human thing. We shush babies. They like that noise while we hold and cradle them, soothing to them. What you should do is like the little clicky noises. You can make little chirpy noises at them if you want, but don't shush them. And then no pulling from the carrier, which you guys have seen has been mentioned a lot because it's a big one that I see done on a daily basis here. Cat owners want to know this stuff. They really do. It's about how you present it to them. And if you tell them the why behind it, they love it. And then they're going to be on board and they're going to join you in this journey versus just saying, don't shush the cat. That's not going to get you anywhere. But if you're like, hey, shh is actually quite offensive to cats because it sounds like hissing. And then they're like, and then they get really excited because now they feel like the cat whisperer and they're part of your journey with you. So just pay attention to how you're talking to the client. They'll get on board and they'll stop clutching the cat and like the crazy stroking that they'll do. And then I have seen people physically correct their cat. Like if the cat growls or tries to hiss or swat at me, I've seen owners like hit him in the head. I just say, don't do that. Your cat's just nervous. It's okay. These are behaviors I would expect for a cat in this position, so you don't need to correct him. Because a cat that's just been hit is not going to be very nice to you. Some really cute exam rooms. Ours is pretty plain, except for exam room 1. It has the Feline diffuser in it. It used to have a plant, but then I tried to kill it, so now it lives on Erica's desk because she saved its life. I'm not good with plants, so it shouldn't have been left in the room with me. And then we have the window is the other big thing in it. So a lot of the cats like to go sit in that window, especially during the day, and then they can people watch all the people in the parking lot. So exam room 1's a great place for your kitty cats. Treatment area, pick the quietest place, or at least ask team members to be quiet if you can't get into an exam room or a different specialty department. Avoid exposure to other animals, and then same rules as exam room. For procedures, for venipunctures, the medial saphenous, which is the back leg vein that runs on the inside, actually is what the feline practitioners recommend for blood draws versus the jugular. It is a smaller vein, so that's why a lot of people are like, well, no, I wouldn't use that. But it's more comfortable for the cat and it decreases their anxiety if you use a back leg versus using the jugular. You use a butterfly catheter to achieve this. It's the same thing that they do for pediatric blood draws in human medicine too, is they use butterfly catheters. Gives you space from the cat's face, which is a safety thing, and from the front claws as well. So there's some advantages for us too. And you just have to take your time. The reason why people say butterflies don't work is that they'll poke them in, attach the syringe and suck. You've just collapsed your vein because there's too much dead space. So what you do with those butterfly catheters is you'll insert them and you let the blood fill until it's at the end of the line. Then you attach your syringe and then you start to gently pull. Now I don't have all that negative space because that line can hold 0.4 mils, depending on which butterfly catheter you have. So you got to let it fill to the end. You're going to be much more successful. And if I need a lot of blood, I just switch out my syringes. So I can hand off my syringe to my friend. They can put it into the blood tube that it needs to go into, and then I can attach a new syringe and pull up a new one. It works well. Alcohol. The reason why I have a question mark next to alcohol, you're not supposed to use them on cats, but I kind of err on, well, I'm trying to reduce my time and get through my procedure as quickly as possible. So I do use a little bit of alcohol. I do think we need to be mindful with the amount. I've seen people like completely douse the cat's neck and chest, and then the cat starts to hypersalivate. They can vomit from the alcohol. It's very offensive. And then you put it right underneath their nose. So just use small amounts of alcohol. Don't go crazy with it. And then what you should do, gold standard, would be warm water. I used it because I wasn't allowed to with Dr. Carney. She didn't allow me to use alcohol, even for my cystos. I had to use warm water for everything. It's doable. It's just a little bit harder. Your vein doesn't pop as nice. It's a little bit harder to part the hair. Cystos were definitely, I just had to use a ton of ultrasound gel and then just clean up the cat, which was fine. For IV catheters, some areas that we can improve upon, we don't really use our lidocaine gel very much, and we should. It goes back to everyone's like, well, the lidocaine gel doesn't work. The reason why the lidocaine gel doesn't work is because people aren't using it how it's supposed to be used. So normally what I see is people will grab some lidocaine gel, they go put it on the cat's arm, and then they rub it on top of the fur. We're not poking the IV into the fur, we're going to be poking the IV into the skin. So how you get successful results with your lidocaine cream is you shave the cat's arm, and then you're going to apply a very generous amount to a piece of gauze. You put that down and you're going to wrap it snug with vet wrap, and then you let it sit for 5 to 10 minutes. That's how it works. Has to have the contact time, and it has to be able to penetrate the skin. So that's what the vet wrap does. Even if you shave it and just go wipe the cream on it and then walk away, you won't get the lidocaine to do the penetration through the skin like you would if you had the vet wrap on it. So lidocaine cream, very good friend, and we can use it more. Just remember that no, it doesn't work if you just rub it on top of fur. It does not. Subcutaneous fluids. This is something we're so good about now. It makes me so happy because I talked about it for years and years and years and years, and now it seems to be standard practice. They should be warm. And I always, when I go into the lab dog room to get subQ fluids, I'm always happy that there's a bag of fluids in there that says subQ fluids on it, and it warms my heart so much. Cats respond so much better to warm fluids versus cold fluids. Dogs would too. It's just a lot of times you guys are giving your dog a full liter, but honestly, your canine friends would appreciate it too. But don't ever give cats room temperature fluids. It'll make your life a lot harder. Surgery. Do we have any surgery people in here? I don't think so. Okay. I added that slide for our surgery friends.
Right.
Yes,
For clients
of course.
who have subQ fluids at home, because I love that too, the warming.
Yeah.
But what do you?
A white warmer. You can have them purchase a cheap white warmer off of Amazon, and they can set it on that.
Oh, okay. Okay.
Yeah.
Yeah.
Because it's the same thing. It only gets to like the 90-ish degrees because it's meant to go in a baby's food. And so it won't warm it excessively. Yeah. So I always tell that. Or they can do a warm water bath, stick the bag in a Ziploc, and then fill the sink with warm water and throw it in there. It's just not as, I don't think, when you use warm water baths versus if you use like a little white warmer. So your hospital cage, when you're setting it up, it should ideally be large enough for a place to hide a litter box. The litter box needs to be away from food and water. You need the most space away. Think about it, because you're not going to go choose to eat your dinner while you sit on the toilet. Like we wouldn't do that. It'd be very odd for someone to be like, I'm going to serve you dinner in your bath. That sounds great. Not really. It sounds traumatizing. So the cats are the same way. You don't want to put their food and water directly in front of their litter box. Put it diagonal is how we get the most space in our kennels, because our kennels are square. We do have a couple kennels that can be a dual suite. That's amazing if we can set cats up in that, and they can have a littering side and an eating, sleeping, feeding side. That's perfect. But I know with space, it's not always doable with it. And then provide a familiar item. I know we don't love clients to leave stuff with us, but it is really beneficial for the cat. So even if it's a carrier and you take the top off and you leave the bottom in it, and then you can still monitor that patient well while it's in the hospital, and then it has something that smells like it, and only change out their bedding if it's soiled. I know sometimes people like to come into their shift and redo all of their patients' beds. That actually is not great for a cat because they just started getting their scents on all that stuff in there and they like it. And same thing with the litter boxes, you guys, is they like their smells. And so if it's not like heavily soiled, leave the same litter box in there. I know we don't scoop it and we usually just throw ours away. So here's some examples. So we have bedding side, and then we have like a feeding side here. I can't see where they put their litter box on that one. There's a third door, so they might have a trifecta. This is too close, so this should bump back here is where that water bowl should be. It shouldn't be right here. It should be in the corner. And then this is an example of our dual one. So you can see I made a littering side on one side, then I have my sleeping area. My sleeping area, I also use that to take advantage of my hiding requirement. I just roll up a towel and I make what's called a circle bed. And then I put the towel on top of it, and then the cat hunkers in. Even those just few inches on the side, that's enough to make the cat feel like it's hidden. And then this is an example of our corner ones we have. My one thing with this is, you guys, please don't put fearful cats in these. It's really scary for us short people because this is exactly what they want to go do. And then you're just like, okay.
off my face. So it's really scary. So please don't put more fearful cats in these ones. They can get back here, they can get back there, they can jump on those shelves, and it's a nightmare to get them out. And I usually walk into people with the big giant cat gloves on and a screaming cat, and they're trying to drag the cat out of the corner. I don't like cat gloves either. It upsets the cats. You guys should just use big blankets and towels. Feline diffusers. Feline towels, wonderful to have in the hospital. And then ideally you would have separate dog and cat wards like we do. And then lowering the lights. I love overnight. We have quiet time now where all the lights get turned down and it's just quiet time and the patients get time to relax and they're not messed with during that time. One of my favorite things that we've added. And if you have a receptive cat, don't forget to go provide positive interactions where you're not doing something to that cat. And you know which ones I'm talking about. They're the ones that like reach out to you when you walk by or then mew at you when you walk by. That cat wants interaction from you. And every interaction you have as that pet's caretaker shouldn't be to do something. It's like why we added the TLC treatment in there. It's just for me to go in there and give you snuggles. I'm not going to take your temperature. I'm not going to give you a medication. I'm not going to take your blood pressure. I'm just literally coming in here to give you a few head scratches, and then I'll leave you on your own way. This is some of the items that we have in our feline ward. So that tub was supposed to get filled with Feline towels. It failed miserably. Tried. Then we have our light dimmer, Feline spray. We do have music players. We have CDs that have special music that is created to soothe cats. If the CDs are gone or not working, you guys can just turn it onto a classical music station, please. That's the only thing cats like. I know Jamie's laughing because Dr. Ochoa came in IM a couple of weeks ago. Andy, do cats like country? And I was like, I'm not sure. Cats do not like country. She's like, that's what's playing in the cat room. And then she walked away. Okay, I'll go fix it. So if you guys do use the radio feature because the CDs are locked or not working, totally fine. Please just put it on. Because Dr. Ochoa will know. She'll sense that it's playing. But no, cats do not like country. They only like classical music. Feeding can be tricky. Like I said, most of the time we'll send pets home if we if they're recovering well otherwise. Everything else is improved. Lab work looks great. They're perkier, but they're still not eating. We'll probably send them home. You want to feed them a normal diet if possible. So this is where we invite the owner to join us with their patient care. So invite the owner to bring in the pet's own food and invite the owner to maybe spend some time visiting and try to get the cat to eat themselves. We don't start therapeutic diets in the hospital typically anymore because cats are not going to have, even if we have the most feline friendly experience in our hospital, it's still a hospital stay. The cat's still not feeling well. We're not going to have the best memories associated with it. I just think about when you got, like, when you had food poisoning, do you have fond memories of the food that poisoned you, like, ever again? No. Like, you can still probably remember exactly what restaurant you got the food from that gave you horrible food poisoning. So any negative thoughts and feelings around food, not great. And not great for the cat. So we'll try to have the owner introduce them at home where it's more likely to be successful. Highly unlikely that you're going to be successful switching to a prescription diet in the hospital. Flat food dishes and shallow water bowls is what you want. We one time about these really itty bitty tiny little water bowls. They were about that big, and I was like, "Oh, what are those?" They're like, I was like, cats. They don't like their whiskers to touch the side of their bowls. It's just weird, but that can be enough to get a cat not to eat or drink in the hospital. So those little teacup plates, those are wonderful. We want you guys to use those. And then the shallow water bowls that we have downstairs, that's what we want to use for cats so that their whiskers don't get inhibited because then they're not going to eat a lot of them if it pinches on them. Warm up the food. Cats aren't usually into cold food. It also makes it smell better. So if they have any kind of respiratory symptoms at all, if they can smell it better, they're more likely to eat. Add chicken or tuna broth to it to make it more yummy. Use a fresh can of food. Just because there's something in the fridge that, you know, is the same diet that the cat wants to eat, you guys, they pay for patient care, and part of patient care is to cover their food costs while they're here. So don't be hesitant if you have a cat. And even though there's a half open can of whatever you need in the fridge, but the cat's not eating, try a fresh can and see if that's enough to do it. And sometimes it is. They just don't like the older food. Don't ever leave the food in the kennel. 5-10 minutes, pull it. After that, it's going to start causing food aversions in the cat. It can cause them to vomit. It can cause them to be nauseous. But I will go around consistently and just see like crusty food in kennels with cats. I just go in there and I pull it out. You guys, I know nothing about that pet. Nothing. But I do know they shouldn't have crusty food in their kennel. So no matter what department or what your role is in this hospital, if you walk by and you see crusty food in with a cat, open up the cat kennel, pull it out and throw it away and take the dish to the kitchen. They don't need it in there. Appetite stimulants, we use like Entice and things like that. Okay, fine. We usually, once again, we're doing better about sending cats home and seeing if that will eat before we start appetite stimulants. But there's some cats that we know, even like hepatic lipidosis cats, it can take them weeks before they decide to eat again. So we can do appetite stimulants in those cases. And then just remember your bowl choice. As silly as it is, it's all those little things. They're sensitive creatures. So liquid medications, you can have them compounded for the owner. So all of our local compounding pharmacies are very familiar with veterinary medicine formulas now. And they have like usually 30 something different flavors that they can make them in, from like banana for ferrets. And then they have like tuna or chicken or turkey. And so you can ask the owner what their cat's preference is as far as like a protein choice for their main ingredient in the normal food, and they'll mix it. For here, because we try not to carry compounded drugs for in-house use, just because the quality things that go into that. Vanilla coffee creamer is your best friend. So the vanilla in the coffee, and it has to be vanilla coffee creamer specifically. Don't do hazelnut or peppermint or brownie or Snickers or whatever. People have asked me, I'm like, no, vanilla. Vanilla only is the answer. And it doesn't, and over even just plain creamer. It's the vanilla itself, with how it interacts with the cat's taste buds, is able to hide a lot of the bitter taste in those compounded meds. So like gabapentin's a really big one. Pina colada flavor, even though it's made for a cat, it's always perplexed me a lot, like why that was the choice. But you can mix it with those. And then the creamer has a high fat content, and that's something that cats really crave and they like. They like fat. And so it will double up as a treat for them. And what I would do if I was at home, you use it like as a reward system. So what I tell owners when they're training their cats is you're going to give them a little bit of vanilla coffee creamer. Then you're going to give them the medication mixed with the coffee creamer. And then you're going to give them a little bit of the coffee creamer again at the end, just pure. So it's good, bad, good. And then eventually your cat's going to get into the habit of that. My little kitten that I brought home 4 years ago from Florida brought a wonderful bacteria with him, and then gave it to all 6 of my cats. And I had to treat all 6 of my cats with liquid antibiotics for 6 weeks. Yeah, fun times, fun times. So I asked Dr. Carney, I'm like, I have no clue how I'm going to give liquid. And it was bubblegum flavored, of course. Yeah, terrible. Azithromycin. And it was much cheaper for me to get it at a human pharmacy versus here. So I went and got it at Feline, but it was cherry flavor. And so I did that, and I did the rewarding system. And by the end of like the first week was terrible, lots of chasing around cats. But after the first week, I actually got a bell. I would ring the bell. The cats would come sit in front of the refrigerator and get their coffee creamer and their medicine. And then by the end of the 6 weeks, I didn't even have to have the bell. And just around dinner time, they would all be sitting in front of the fridge for me. It was awesome. Cats are extremely smart, but you do have to reward them. They need positive reinforcement. Negative reinforcement doesn't really work with them. So I'm a firm believer in that now. Lauren still to this day makes fun of me for my vanilla coffee creamer, but it works. And if you ever see me give gabapentin in the hospital, you guys, I always mix it with vanilla coffee creamer. We have tons of that stuff around here, so you can just grab it from up front or upstairs.
Reminder, no sugar free.
Oh yes, thank you. Yeah, no sugar free xylitol. Can have xylitol. So please tell clients that. Very important that we tell clients that. Pill pockets, great if the cat eats them. Cats are picky, so some cats are like, whatever, I hate pill pockets. My cats love pill pockets, so I put Eunice prednisolone in her pill pocket every night. It makes my life wonderful. But I understand a lot of cats don't like it. You can hide it in the food only if the patient is eating super, super well and loves their food. Please never, ever, ever put a pill in food that a pet that has just started eating or has been nauseous or vomiting in the hospital. if they get that pill and they chew into it, that food, done. That cat's never going to want to touch that food again and is going to have real trust issues with you around feeding and probably isn't going to eat for you again in the hospital. And then hopefully can go home and mom and dad can rebuild that trust, but don't ever hide it in food unless they're eating well. And then pilling, I'll show you guys the spot hold. You're the one that did the blood draw today.
Bigger one.
Oh, I don't know if you're the bigger.
You know, small. That's too small. It's more.
Yeah, so we call it a spot hold, and so it's how you can pill a cat. It gives you a couple seconds where you can stick your finger in the cat's mouth and pill it without getting bit. So what you do is your thumb and your pinky are gonna go on the outside of the ears, and the other 3 fingers go in the middle, and then you're gonna gather, and I'll show you guys that you can stick your finger in their mouth. It's kind of cool. We'll see, we'll give you a second. Where's your sister? Oh, no. I do this hand. Yeah, and then you go like that, and then you can stick your finger in. Okay. I want to see your sister though. If she'll let me do it more. In this case, I would use a gun. I wouldn't use my finger on this particular cat, but I could easily get a gun in there. She under the benches. You can put your hands to her out. They're heavy. I will warn you of that. Oh, right. She's oh, she screeched more. Back up more. Oh, I promise it's not bad. We're not even gonna really give you a pill. Hi, dear.
Oh,
Okay.
yeah, you're the third person to just. Yeah.
All right.
Yeah,
This is your third person. It's fine.
Oh, I see. Sorry, I thought you were just gonna lift it straight. Your life is okay.
Yeah, it is.
Yeah.
Oh, she went behind it. Okay.
Yeah. This is ridiculous.
Okay, I have to, hi. Hey, sweet. Oh, hi. Come here. Can I borrow you for a second? Your friend was not very excited. I'll show it.
Didn't scratch his out.
Oh. Yeah, but, yeah. Feel the word coming out? Feel that word coming out? Oh, she's kind of big. I have a hard time with bigger cats. Okay, and then I can stick her in. Okay. So that's why we call it the spot hold. It's like kitty magic. Gives you about, if you do it really well, you can get about 10 seconds. As you're learning it, I would really only plan on like 3 seconds or so. Or if a cat is more agitated, like our first friend, I wouldn't, that's why I didn't put my finger in the mouth, but that I felt very comfortable because I wasn't getting growls. Ears were still in a proper position. I would have just used a pill gun in that case. So that's a spot hold. You can teach it to owners too. I try. I'm one lady that brought all of her chemotherapy to me for like 2 months, and I had to pill her cat once a week with my magic hand hold, is what she called it. And I was like, do you want to learn? I was like, I can teach you how to do this at home. And she really just, she would rather drive in here once a week for me to get the pill. But that's a spot hold, you guys. There is a video of it on our website of Dr. Carney doing it, but it does take practice. So if it's something you want to learn, you can come grab me and I can walk you through it. And I recommend starting with a pill gun as you're learning it, just because I don't want your finger to get chomped as you get more comfortable. So cat-friendly items, we have cat muzzles, Just make sure, I don't ever trust that they're clean, so I always clean them before I use them. And then I spray it, with a Feline spray, let it dry, and then I'll put it on the cat. So we have the plastic ones. I prefer the plastic ones. The Velcro ones just slip off and they accomplish the same thing, but. And the Velcro ones, the long side goes over the eyes to cover their eyes. It's no evil thing, but I prefer these guys. Cats respond really well or really poorly to the muzzle, and you won't know until you try. So, but obviously if they start flailing around and freaking out, you just need to remove the muzzle and be done with it. And said that didn't work for the cat. Some cats, you put it on it and they're like, I'm not going to move now. That's great, things like that. But not all cats are going to respond like that. Same thing too, covering the eyes does help your safety because then they can't see where they're striking. Cats always will look at where they're going to hit. So if you ever see a cat like staring at your hand or staring at your face, they're gonna go for those areas. Quiet small clippers, if you can have those. I know those are a hot commodity. I don't know if I want to share. If you need small quiet clippers, you can come see me and I'll hook you up. You just have to promise to bring them back to me. Dr. Carney gifted them to me. So small little blood tubes down there, thick towels and blankets. We have abundance of those. Please use those over the cat gloves. Cat gloves aren't great. And then the cat masks. The other thing that I want to show you guys here is when we're drawing blood and things like that is head tapping. I want to take a minute to talk about head tapping. So there's a much better alternative to head tapping that we can do for our kitty cat. I'll show you head tapping. So what are my ears doing? Do I like that? No. Gosh, you've been so nice to me. She's like, why would you do such thing? What you should do is you should do counterclockwise circles. She's purring. What are my ears doing? They're up. Happy kitty, I'm purring. That's so much better. If I was having my blood drawn and I was nervous and someone came over and started hitting me on the head, yes, I probably wouldn't move as much anymore because I was scared and it wouldn't be the most comfortable thing. Probably the same thing would happen if someone came over and rubbed my back when I was getting my blood drawn. That also would be enough of a distraction from the blood draw, but it's in a positive manner. It has to be counterclockwise. If you go clockwise, it's invigorating and it will amp them up. There's a whole, you guys, I used to think this was all mumbo jumbo. I promise you 5 years ago, if you would have told me, like, if I believed any of this, I wouldn't have. But now I'm a huge believer in like acupressure points and the direction that you're going with your energy. After working for so many years with Dr. Carney, I just fully believe it. Now, the other really great option has to be counterclockwise, not clockwise. That's invigorating. That brings invigorating energy to them. It will de-escalate them. Armpit rubs, especially, especially when they're on their back for things like cystos or ultrasounds. You can avoid a lot of sedation on pets, cats specifically, if you did armpit rubs during their ultrasounds. Soothing, pressure point. Leave it now. I do. If you wanted papers on it, I asked Dr. Carney. I'm sure she would send us over papers on why it works. Exercise. Don't forget about exercise for our cats. I think we just figured that they're okay, even if they've been here for several days, they're fine sitting in that one kennel. Cats like exercise. Take them into a bathroom, let them walk around, put a litter box on the floor, put food and water out. They're more likely to eat, drink, and go to the bathroom. Once again, exam rooms, you can borrow a specialty room if that specialty isn't in there, and you'll see an improvement a lot of times in their appetite and their elimination. These are the cats music options. We have, I thought we had Through the Cats here. I'll have to see. Both of those are fine. They're available on iTunes as well. But like I said, if you guys can't find those or the discs aren't working, please just put it on classical. Grooming. Sick animals in general are less likely to groom. Just like when we're sick, we're not usually keeping up with our normal bathing routines. And then when you finally take that first shower, that first bath after you've been so sick, it's like, oh my gosh, I feel like a new person all of a sudden. Cats are the same way. They're very clean creatures, and it's hard for them when they can't groom themselves, especially if we put something like a collar on them. It's really important that we help them out with that. And I'm not talking about giving them a full bath. That is not going to make any cat happy. What I'm talking about is brushing. If you give them a liquid medication or a liquid diet and they have food around their mouth, that you don't just put them back in the kennel, take a minute and take a warm washcloth and wipe off their mouth, wipe off their bottom if it gets feces on it, because they can't clean it off themselves, or if they have litter stuck to their feet. The cats don't like those. If they're starting to get matted, brushed or cut out those mats are painful for them. So don't forget about those little things too. I know there are some cats that they will bite your hand if you try to go in there to clean their face. Those aren't the ones I'm talking about. But also that goes back to when you present the pet back to the client, it's really nice for them to be. Gabapentin is awesome. Gabapentin is great for our anxious cats. For a healthy cat, we usually say 100 milligrams per cat. Problem here is a lot of our pets aren't healthy, so usually the doctors will give you an exact dose. I usually will just ask for 100 milligrams, and sometimes they get shot down. But I'll try to give myself 100 milligrams, and it works pretty well. It reaches its peak at 90 minutes. You start seeing the effects usually around like 40, but its peak effectiveness is 90 minutes. Advocate for your patients. If you have a cat that came in nervous and we're going to hospitalize it, I instantly say, can I give a dose of gabapentin now? And then can I get this cat on Q8 gabapentin? And I've never been told no to that. It's just our doctors have so many things that they're going through and they're getting them what they need to treat their disease process. Sometimes those little things fall through the cracks, but that's where us as their caretakers comes in, because we're their advocate for them to think of those little extra things that might have slipped through. So I always ask for gabapentin. And if I get an early morning drop off that's nervous and I am, I'm like, can we get my gabapentin? And then we'll be happy when it goes home. When that patient returns, a lot of times we send them home with scripts of gabapentin that the owner can administer before their return visit. So those are the things that we can do to advocate for the cat. And that we laugh because a lot of our cat owners are like, oh no, he doesn't seem like he needed it. So I skipped it. And you're like, oh, well, he's not nervous at home. He's here. Thanks. So why we care? Improve patient outcomes. They're going to heal faster. They're going to feel better. Our patient safety. We're going to make sure we're getting accurate lab results. And then we're going to get through those exam and treatments faster. A satisfied owner, which means more felines are going to come see us. Yay. Cat owners are 50% less likely than dog owners to bring their cats in. And a lot of it is because of the owner's perception of how their animal feels about vet visits, and that the staff doesn't maybe like cats or work well with cats. I had one lady that came to us and like fired her vet because her cat was being carried like this by the technicians, then it got hit into a door. And so when I went to get the cat from the car, she was like, well, how do you carry a carrier? And I was like, well, I pick it up from the bottom. And like, I always carry my carriers like this. And she was okay, good. Like they know the things that upset their cats and they are particular and they know what they want. But if they see us doing those feline friendly things from the start, we build that trust, and then we're going to get that cat to come in here. And also if their cat doesn't leave a stressed out mess every single time, and then we're telling them, we're giving them anti-anxiety meds, they love all that, and we're going to build a good relationship with us, and then we can see their kitties and do preventative care, so we're not doing emergency care on them. Of course, safety, and that's a big thing for us. We see, I think this week Lauren already told me we have 3 bites and scratches from cats this week alone. 3. We gotta switch things up with how we're handling the cats. It's a huge safety thing too. Cat bites and scratches can be really nasty. I've seen people have to go get surgery from a cat bite before because it went into their joint and the joint went septic. So it isn't just a benign thing, the bites and scratches from the animals. And then improve job satisfaction, because we feel good. We're not afraid of our patients. We are creating that good bond, which is why most of us go into veterinary medicine, is because we love animals and we love that very special bond we have with them. So we have a better relationship with our kitty cat. All right, and that's just a cute picture of my 2 babies. What questions does everyone have or anyone have? If you think of questions, you can always find me. I'm here Monday through Friday.